Okay, we're ready to start session 3, part 2. And we have all of our speakers up here to join us, and we will be taking questions from the audience. We want to make this more of a dialogue, so please, if you have questions, we have a microphone here and one on the other side of the room. And I think the other thing I should do is announce that Susie Gates, who is the co-facilitator for this session, has joined us. And she's going to start off with the first question.
All right, thank you. The first question is for you guys, kind of reflecting what you spoke about, what others have spoken about today, is where do you think our blind spots are and where are our opportunities? So, because Gary's trying to ignore me.
I was deep in thought about your question.
Would you like to start?
Sure. I think we have two potential blind spots / opportunities. One is that there is some risk that we're talking to ourselves and that we're not taking the perspective of to whom the message or the communication is being sent. And probably related to that is, if you go back, Sylvia's framework in the beginning is resonating with me about who's the intended audience first and what's the desired outcome. And I guess the scientist in me is also saying, like, well, how are we going to measure the effectiveness of this? So if it's to get somebody to click on a website, if it's to get somebody to enroll in a program, if it's to get somebody to pass legislation, which I realize is a much longer tail, how do we judge the efficacy of it? Because I think there's some risk that we could do a lot of talking and messaging and framing and all those. They're great concepts. I think we have to be clear about what's the intended consequence, who's the intended audience, and come up with a clear measurement plan to assess it.
Are there others who'd like to talk about blind spots?
I mean, I think for me, listening to Patty specifically, well, across the board this morning, for me, it was, as a communications person, is the unintended consequences that you don't see. So you're focused on an audience, you're focused on a message, but understanding, like, what's the sort of equal and opposite reaction of this message that I need to consider. I also think part of the obstacle is that we're all working in silos, and that which consequently creates an opportunity, which is sort of, I refer to the reference or the analogy of swarm mentality or swarm intelligence. But how can we sort of work cross-functionally, cross-organizations, learn best practices, iterate solutions? Because the answers reside in 1,000 places, not one place. And so I think that's a tremendous opportunity, is to try to design a system to enable that to happen.
Paula?
Well, I've mentioned the economics before, and it seems that couching the issues, and specifically with state legislators, is with they see their role as being allocating budget funds, be that on a 1-year or 2-year budget for state agencies, so not necessarily in the weeds with policy. But when so in talking about obesity, healthy eating, active living, the information we got over and over was it needs to be couched in how that will affect the economics of the state. Create an environment that young families, the highest educated, the high talent will want to move into, and to have a positive impact on the bottom line of the state.
Marla, do you have anything you wanted to add?
I'll just kind of highlight again some sentiments that have been shared, and it's really about getting out of our bubbles, our individual bubbles within the health community, as well as the other communities that we are connected to through our work, and just being mindful of that as one of our potential blind spots. We're health zealots. We live it, we breathe it. We put health first all the time, so let's not let that get in our way of success.
Right. Do you have some examples of how you have gotten out of your bubbles or out of your silos that might be an example?
One of we work with a couple partners in the transportation community. And so really understanding, or not understanding, there's so much to understand about transportation policy that I know it's important. I know it comes with huge resources within the community, but really being able to connect with them and work with them to integrate health into the broader transit discussion has been one of the things that we've been successfully doing with some of our core partners, Smart Growth America, Safe Routes to School National Partnership, state departments of transportation, and really trying to get out of our own way.
How did you get that conversation started with transportation?
It's been going on for a long time. There are lots of people that paved the way for that. We're just kind of keep working on the backs of others. CDC was really instrumental 20 years ago and starting to forge some of those initial conversations and just kind of keeping the doors open and reminding our current advocates to knock on the doors and find those groups and even do some funding to some of those groups to lead campaigns.
Great. Other examples?
I do think one answer, and I referenced it, could be in using the approach of design thinking as a methodology to bringing a cross-functional team together. It's amazing to me that we all suffer from this sort of silo mentality in organizations, corporations, large organizations. It just becomes that much more pronounced. But just getting people in the room that don't normally talk and hosting a session with consumers involved so you get the voice there. Everybody hears what the problem is together, and then everybody works together on a solution, a prototype. You get it out into the market together. You see how it impacts. So, we host these sessions that are 5 days, 4 days, 3 days, so you can do them quickly, sort of in this rapid development methodology is really effective, and it gets people to kind of work across silos.
Great. Anything else you want to add?
Not specific to this project I was talking about today, but the National Association of Chronic Disease Directors has a model where they call it state technical engagement models, where they come into a state and work with the state health agency staff to bring together partners at the state level to convene around developing the goals, objectives, and the measures that they will look at on chronic disease issues, including some projects that address obesity and healthy eating, active living specifically. I've had some good success with that.
Great. All right. Well, this talking about blind spots kind of has made a nice segue for the next question that we have, and that is, what are you seeing on the horizon for obesity messaging? Where are we going? Where should we be going? How can we make sure we get there?
I do like the whole notion of framing it as a gain. So the idea that people see it as a positive in their life as opposed to removing something or having to replace what I already love, the food that I love, the activities that I love. I have to now do this obligation thing. So if we can continue to position whatever the message might be, in my case it was physical activity, but as something that's additive, it's something that's going to enhance life, it's something that's childhood development, it's something that brings the family together, whatever that sort of gain might be. I think that sort of being at the core of however we use today's tools to communicate needs to be part of it.
Tools and sensibilities, I think, of where the public is going, consumers are going. Yeah. Other comments related to that? The future? Where are we going?
Yeah, I would add to that. I think that we've talked about partnerships, but I think that can't be overstated in terms of what we hear from policymakers, how important it is to hear consistent messages and to put together the resources. And I'm not just talking about money, but the resources and influence of from every walk of life related to an issue on healthy eating, active living. whether that message is directed at the local level or at the state level. And then just, bringing into play the different, because there's so many forces at work in that conversation that are for and against whatever the proposed policy might be, that it's really important to stand on the science that we know and bring together the partners that can really have an influence in that conversation.
I would just build on that by saying standing on the science is really important. Whatever the communication is that we're trying to drive and to whom, wherever we're trying to drive it, we ought to be trying to drive behaviors that have empirical support. I think a risk in a future not so great is that we get people to engage in things that haven't been proven, or maybe even worse, have been proven not to be effective. So.
Well, without giving away trade secrets, what is WW International looking for the future? Can you speak to that?
Yeah, it's not so secretive, maybe for better or for worse. It's really continuing at that slide that I think about literally on a daily basis, is where's the intersection between consumer insights, or another way to say that is persons affected by overweight and obesity, and where the science is. And I think where that goes in a optimized way, and we're fortunate at WW have a great consumer insights team. That's to me the secret sauce. If you're looking at trends, we're not going to, again, come up with something and make it up and say, if that's what you want, this is what you get. There's no science. So I think that intersection is gold. And I think it's gold today. I think it's gold 10 years from now, 20 years from now, because you're linked. A key principle of behavior change, I know I'm saying this ad nauseum, is meet people where they are. That's the way to get them interested. The way to keep them engaged is that they can wrap their mind around this process that's personally meaningful to them, and continuing to talk to people about how is it meaningful, how is it not meaningful, just the whole journey, less than a particular program, I think is pretty key.
Okay. Questions? Don't forget, we have 2 microphones available for the audience to ask questions.
Bill Dietz, consultant to the Roundtable. Thanks for this panel. And I think that my question is not only for this panel, but also for the summary panel. Susie, I was trying to remember who the congressman was that allocated the $125 million for the Verb campaign.
Waxman.
Yeah, Waxman, as he retired. So that's never going to happen again. I mean, we're never going to have $125 million to spend on a physical activity program or an anti-obesity program. And as a roundtable, our strategies are a bit more limited. And I was thinking that one of the things that I think we've begun to do effectively is to change the language that's used here and by our panels related to obesity. And I think all of you were probably instructed to use people first language, which we now do routinely. And I think the journals are beginning to change. And I think that's a critical step because it changes the conversation and perception of obesity. But I'd be interested in your thoughts about what we as a roundtable could do. I mean, think of us as groups that have our own networks through which we could spread some of these strategies. But and I think our work as a roundtable is more effective on a network basis than on a public campaign basis. So accepting that we have the potential to influence networks, what would you recommend we focus on as a pivotal strategy that would address some of particularly the stigma related to obesity, where I think we can be effective, but and that would encompass some of the things that I think Gary has talked about in terms of reframing the obesity.
I'm wondering if there are ways that you can pose central either research questions or consumer problems or human problems that we put out to the network to have different people study it, test and iterate, and then feed back the solutions to the group, so that because I think that's the power you have, is that you have these incredible networks of people that are doing amazing work in their own communities and their own organizations. So if somehow they can remain connected, not just in the in the theory and the thoughts and the strategy, but actually going out and testing stuff and bringing that knowledge back in, sharing it, collaborating.
I can't think of an example where we've had that capacity. I was thinking more along the lines of what kinds of are there several messages that reframe obesity in an effective way that we could spread out through our networks?
Yeah, so through the lens of policy, I think we have a lot that we could be sharing from the historical injustice frame that, so many of our policies have impacted where we are in the obesity realm, from the federal policy making to the state policy making that we've done through redlining, through how we distribute food, through how we grow food, and being able to message that people are not where they are today just because they are, that there's been a whole framing around our society and how we live and breathe and walk and eat. And so to me, that from a policy perspective, again, how we message that matters, so that it's not an individual issue. It's more of a community issue to solve.
Mm-hmm.
I'm not sure I have an answer to your question, but there's something about how the roundtable could work on one focused issue across stakeholders that's really appealing. Bias and stigma seems to be the sweet spot, because it affects people's lives quite fundamentally, independent of all the other stuff, whether policies get changed, whether treatment improves, whether you get this treatment or that treatment. It seems so core and fundamental to just a basic human value need that seems like it's got big payoff. Where I stumble on the next step is, do we know messages that work, and what's the outcome we're trying to drive? So to the earlier point of design thinking and iteration, I don't know how the roundtable does that, but I would hope that we could get, at least glean probably from Rebecca, what kind of messaging does work, maybe how to capture these natural momentum moments that just happened in response to stupid comments. Like, I don't know how to do it, but there's something appealing about the roundtable doing that, I think.
Yeah, maybe adding to that is the sort of cultural layer too. So what messages or what conversations work in different communities. I mean, looking at it from a cultural perspective, exactly. Certain things may not resonate in the African American community that does in the Hispanic community, or there are similarities that can be applied one place to another.
Agreed.
Mm-hmm. Okay.
There was one. I'm not sure this answers the question either, but it made me think about some of the comments that we heard from state health officers and legislators and key informants in this project, that while they could cite examples of collaboration with state departments of transportation and give some examples of where they have promoted healthy eating, active living policy with some agencies, one of the areas they lamented was not present is collaboration with some of the public funded health insurance, Medicaid, Medicare, and such. So no real solutions offered as to how that might happen, but just kind of that general thinking that it is an area to explore in terms of how do we set the stage for communities that have high prevalence of individuals that are recipients of public funds.
Okay, next question.
So you just prompted something from this morning to come back to me, which was Brian, who was talking about how you don't tell people not to be a bigot or a racist, but rather you go after something like bias and stigma by offering up positive images. And that just comes to mind as something that perhaps the roundtable could do. But I had a question for Gary, and anybody else who cares to comment on it. And that goes back to something Rebecca said about diverse audiences having diverse needs for language and messaging around obesity. And I'm wondering, when you have such a broad population affected that are going to hear your messages, maybe might not even be your target for your messages, but they're going to have strong feelings and be out there in the public square talking about your messages or your identity or your image. How do you deal with those radically different stakeholders that range from an eating disorder community, fat acceptance community, and an obesity advocate community, and then the folks who are the core of your community at Weight Watcher, or at WW. There I go. Sorry.
Old habits are hard to break.
Yeah, exactly.
There's a lot in there, Ted.
I figured you were up to it.
I think the first problem to solve, as I heard it, is that among our members, is whatever the public numbers are, around 4.5 million globally, there's going to be diversity. Arguably not enough in this state, but we're in our current state, but quickly evolving. So I think it's a challenge to us. I don't have a great answer. Again, we talk to people routinely and see how the images are resonating. And it's more just, do I see people like me seems to be the biggest thing. But so that should be a relatively easy, but to your problem to fix. But to your point, how we say things, the phraseology, we certainly depend, especially when it gets to different languages, but also just different cultures. How something is said in the UK is different than Australia, than different than the US, and clearly different than in France and Germany and other countries we're in. So I'd say a lot of what we do is think globally and get that about what are the principles, what are the global consumer insights, and then really trust our local teams to make sure that it fits in culturally. But to your point, that's just one level. Then there's, within a culture, there are subcultures. I'm not sure we've nailed that, but it's certainly a focus for us. So that's an internal problem, if you will. I think the external problem that you mentioned is real. And what Patty said has resonated with me a lot, that when you look at whether it's Hayes or NAFA or OAC or physicians, surgeons, community providers, everybody can align that people with overweight and obesity should be treated with respect and with dignity. And so that's a galvanizing. When there is tension, I think it's been useful. These are one-on-one conversations, not big public things, to just say, like, we're all on the eating, folks with who advocate for eating disorders, and it's a condition that is serious and should be advocated for. That's common ground. So that's one approach. And I think there's more commonality than you might read in newspapers or at the fringes of some Twitter feeds. I think the other thing that we do, and sometimes it's successful, sometimes it's not, is lead with the science. So if there's a question about whether there are some unintended consequences, as was mentioned earlier today, there's very few things that haven't been studied. And does this cause that? Does doing this kind of program get kids, adolescents, adults to act in certain ways? So we find that it's our role, we believe it's our role to disseminate that science. And I don't know what else we can do after that. A lot of these debates tend to turn out to be more like religious or political debates, where you really, and that's where we come back to science and come back to, is there a common ground between people with, at least on the surface, diametrically opposed views?
I think we have time for one more question.
Hi, Sarah Bleish, Roundtable member. So there's a steady drumbeat this morning about messages need to be clear and simple and consistent. And it's interesting how the WW model is all about the individual's journey, whereas Marla, what you're saying is do not focus on individual choices, focus on these broader set of issues or sort of community impacts. And what we know is that obviously policymakers care a lot about what the individual public thinks about this problem, and people think that it's caused by you and me and not by these broader societal factors. So I'm just curious to hear your thoughts on that in terms of message framing and being consistent about sort of individual versus these community approaches to obesity.
Yeah, through my lens, I think both approaches are needed. I think you need to tell personal stories to make the broader community issues bubble up and percolate. Everything is personal. Relationships with your legislators are personal. So really telling the story and bringing things to life are important while you stay in that broader message frame. So like Maddie's story that I shared about her not being able, like her desperately wanting to be able to be independently getting to work and her not being able to do it, was an individual compelling story shared in a broader message frame of not being able to access places. I think when I don't do the work in the individual frame, but with WW, a lot of people are going there for individual help, which is just a very different kind of messaging consideration as well. So there's space for all of those areas.
Yeah, I think the way we try to balance it is that it's not an either-or thing, right? Obviously, people are joining our program because when I reviewed these consumer insights with you, they want practical, science-based, believable, livable tools to help along the journey. Partly the way we frame that journey is there are some barriers to it. I can tell you the more that we lead with this is tough, the less engaged people are, especially when you're trying to inspire on the front end about, this is a way to start a journey. We have a lot of our own history about how campaigns that led with this is a really difficult thing. As a clinician, I cried watching the ads, but they don't work. They remind people of how difficult it is. They're not inspiring. Once we have somebody in the program, I think there is an opportunity to balance. And it's never, I know we're using these phrases. We've never used individual responsibility versus social determinants or context. It's really just what can you do with whatever hand you've been dealt. Wouldn't even say that to a consumer, but I guess the point I'm trying to make is it's not like society has conspired against you or it's all, quote, your fault. Both are not very motivating and are probably both partially true. That's not even a way to frame it, because I don't even want to get close to the word fault. There's a way to think about this. It's not either or, and we're trying to help individuals change their behaviors in ways that are sustainable, and that's going to need to take into account the environmental context.
Great. Thank you. Thank you to our panel.